People are exposed to numerous risks in their daily lives. Such risks can be life cycle related, economic or natural disasters. Research has found that people who are poorer tend to be less educated and are likely to experience such risks earlier than expected. Insurance helps reduce the level of risk and the impact this has on people financially. Insurance has significant benefits to policyholders, governments and industry. Despite such benefits, 95% of Australians do not have adequate life insurance. This will cost the Australian Federal Government $1.3 billion over the next 10 years. This problem is not just in Australia, it's actually a problem all around the world. Our research shows that there are 7 reasons why we have such underinsurance epidemic. Let's have a closer look at what we found. Research has found underinsurance is closely related to lack of financial income. The most common reason people give for not having life insurance is because it's too expensive. Those with low incomes are particularly exposed as they have the least capacity to quickly recover. On the contrary, those who had greater than average cover tend to have higher incomes and are not so price conscious. Studies have found that in addition to level of income, age was also an important factor that affects the take-up of life insurance. As the primary earner grows older, he or she initially becomes more likely to buy risk protection. Those who are younger and poorer are more likely to suffer from biological risks and are more likely to have high rates of smoking, obesity, poor dietary habits and lower levels of physical activity. Such behavioural factors are contributors to the cardiovascular and cerebrovascular disease. These diseases are the 2 leading causes of death in Australia and account for 22.3% of the total death. The level of education has a direct impact on the type of job and earning potential. Research explains that a high level of education results in a greater awareness of life's uncertainties and hence highlights the benefits of life insurance. Those with lower levels of education commonly have a shorter lifespan by up to as much as 15 years. Research provides evidence that the level of education not only impacts the quality of health, but one's health impacts their level of educational performance. For example, those with ADHD, depression and obesity generally have lower GPA scores than their cohorts, and the offspring of parents with psychological problems are more likely to develop these disorders. Studies show a strong negative relationship between household size and resources available per child. As the number of siblings increase, educational performance decreases in comparison to children with fewer siblings. The vast majority of prior research has focused on the amount of life insurance purchased as a function of various demographic and socioeconomic variables. Psychographics, lifestyle factors, have also been found to be important determinants. And when all 3 are combined, there is much more complete and understandable profile. Those who own greater amounts of insurance were found to be self-sufficient and in control of their well-being. They are also better educated, have higher incomes, and are not price conscious. Studies of particular health conditions have continued to find a strong relationship between uninsurance and mortality. In the absence of insurance, there was an increased risk of death due to stroke by 24% or 56% depending on the type of stroke. Underinsurance doesn't just impact our welfare system, but also reduces government tax revenue. So what are the options for policyholders, industry and government? A greater emphasis on insurance education and communication at a younger age must be placed. Promotion of financial advantages for the average person to increase their insurance cover within their super. More emphasis on insurance from mortgage providers at the time that mortgages are taken out or updated. Some further research. The perceived sources of expert advice and when it is sought from accountant solicitors is important. The impact urban myths have around people buying decisions around insurance. Attitudes to insurance, both within super and outside. Time is ticking. We have an underinsurance epidemic. Ask for more information at www.peraltafinancialservices.com.au